GLP-1 receptor agonists and DPP4 inhibitors explained in 4 minutes. Let's begin. GLP-1 receptor agonists and DPP4 inhibitors are two classes of medications that are commonly used in type 2 diabetes to lower blood glucose. GLP-1 receptor agonists are subcutaneously injected medications and can be identified by their suffix "tide." For instance, Liraglutide, or its brand name Victoza, or Semaglutide, or Ozempic. In contrast, DPP4 inhibitors are oral tablets and can be identified by their suffix gliptin. For example, Sitagliptin, or Linagliptin, or Saxagliptin. But how exactly do these medications act to lower blood glucose? Well, when food moves through our intestinal tract, some special cells in our intestines, called K and L cells, detect these nutrients and release a peptide called GLP-1, or glucagon-like peptide 1. Now, GLP-1 has a number of different effects on the body. It binds to the GLP-1 receptors on the pancreas to increase insulin secretion and reduce glucagon secretion. Secondly, it acts to slow down our GI tract to reduce the absorption rate of sugar. Lastly, GLP-1 also acts on the brain to reduce our appetite. As a result, all these effects result in a reduction in blood glucose. Unfortunately, the natural GLP-1 produced by our bodies is very quickly degraded by an enzyme called DPP4, or dipeptidyl peptidase 4. So the effects of GLP-1 are quite short-lived. However, based on this natural GLP-1 that our body produces, scientists have designed a drug that mimics all the actions of natural GLP-1, but is resistant to DPP4 degradation. So the effect of GLP-1 lasts longer and we get better blood glucose lowering. These drugs are known as the GLP-1 receptor agonists. Alternatively, scientists have designed DPP4 inhibitors as well. These are drugs that bind to the enzyme DPP4, preventing it from degrading the GLP-1 produced from our body. This allows the GLP-1 to last longer and carry out its effects without being degraded by DPP4, resulting in reduced blood sugar. It is worth noting that both of these drugs are very low risk for hypoglycemia, and the GLP-1 receptor agonists are also known to help with weight loss. Moving on to the side effects of these medications, the main side effect we see is GI related, since part of the effect of these medications do involve the intestinal tract. Thus, some patients may experience nausea, diarrhea, or constipation. Another side effect is increased heart rate by about 10 to 20 beats per minute, and this is only seen with GLP-1 receptor agonists. And flu-like symptoms, such as headaches, runny nose, and sore throat, are also potential side effects.